Hello. I feel like I should be like everybody else and say, "Welcome to my YouTube channel. Thank you for watching." I don't know. Should I or shouldn't I have a formal intro? Today's topic is, do you believe in mental illness? So, there's going to be a couple story times here. Now, you hear it all the time. Somebody is a little bit different, and people are quick to say that they're mentally ill. Take the Kanyes, take the Azealia Bankses. Um, People tend to think that they are mentally ill. Now, there are also people who say that they're mentally ill, like Jim Carrey. I believe he has bipolar. I think they said Kanye did say he has bipolar. Mariah Carey has bipolar. Um, there are different celebrities or well known people with mental illness. The question is, do you believe it's do you believe in mental illness or do you see it as an illness? Um, Kanye said, I hate being bipolar. It's awesome. So, would Kanye be Kanye without bipolar? Because it's a personality disorder or mood disorder. You can get real technical when it comes to psychology, but psychology is how old? A science. A science. So, I don't know. When you think of some of the great artists, like I wonder what Van Gogh was when he was creating his paintings. Do they need that to be creative? Or what happens when you have different artists who start self medicating? I don't know, like Robin Williams, I know, suffered a lot from depression. And he was doing a lot of drugs. I believe he overdosed on drugs. But some people don't like the medication because it doesn't make them feel like themselves. Some people don't like it because they tolerate the lows so that they can feel the highs. Um, some of these highs, I guess, are like natural highs. What can I say? I was watching Star, and the line that really jumped out at me is when Lance Gross's character said, uh, "Oh, Star is just depressed, but that's just for white people," or something like that. Afforded the opportunity to be mentally ill, like based on your socioeconomics. Like if you have a lot of money, you can afford to be mentally ill, but if you're poor, you just have to sweat it out, struggle. Do you believe that your circumstances can make you mentally ill? There was a time in my lot of stress, and I was abusing legal substance. There's levels to abuse. I wouldn't say that I'm like an alcoholic or a stoner or anything like that by any means. But by the way, marijuana is legal in Canada, so um, and it's legal in some states as well. Uh, and I got so stressed, I started talking to myself and like hearing voices, but like I don't know. Now some people may hear that and immediately like, oh, it's schizophrenia, like because you're hearing voices and you can't control it and stuff like that, and it's just disrupting your life. The DSM essentially, um, in psychology to help diagnose people. Uh, has all this criteria for what it's considered to be a disorder. Hear voices, but then what are those voices? So if they're religious, automatically it's uh the psychologically it's schizophrenia. But then if you go and tell somebody, say somebody in the church, they don't believe that you're mentally ill, or at least the church that I went to, they didn't believe that I was mentally ill. um Now I personally believe that I suffer from what is um or suffer from or live with what is known as anxiety and depression. I lately I've been having a lot of intrusive thoughts. Like I've had a hard time forgiving myself for things in the past. Um and these things keep popping up, and then when I say hearing voices, it's like we all have bugs. Well, not apparently there's some blank said. Um, so uh, I I'm very aware of what my inner dialogue sounds like. So when I was younger, I went on birth control. I'm putting all my business out there, but I went on birth control because they told me that I, because I'm anemic. So they're like, you need it so that you can get your iron levels up and blah, 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 and all that jazz. So I went and I gave it a try, and started hearing voices, and I literally swore it was the devil. Now, they would say, well, that's probably just, it might be causing schizophrenia. You might be predisposed to schizophrenia. For me, I felt like I was hearing the devil. I'd rather go and sit with that pastor and figure that out than go to, um, go to a doctor, simply because they also are the ones that put me in that situation. But I don't know. I don't know how I feel about the topic, because there are people who need the help, and the it does a lot for them. But I found that like a lot of the best psychologists that I've gone to are they practice cognitive behavior therapy. So it's kind of like changing your way of thinking to change your attitude, to change the way you behave. Um, but the way they do it, it's more personal and humanistic. So um, it's a conversation, and then they teach you the techniques. And then I've had some that they're psychologists that are like throw the book at you, and it's like, well, the definition of this is this, so what you need to do is go home and blah blah blah, and I'll give you this homework for you to do. And it's like, you're not helping. um so and then I find that some people who are not psychologists can also be very helpful and give good advice on how to deal with um, different issues. There are how many people who turn to the church when they're depressed, or not even the church, like a friend or a family member. Like, it doesn't necessarily need to be a psychologist. Now, they might actually be experiencing what is clinically known as depression or anxiety, or say having a panic attack or something like that, but they didn't have to go through all the stigma that comes with these labels. And so that's why I'm asking. I just want to know what people feel about that, because I've been feeling weird about it just lately, living my life and going to doctors to get what is an expert opinion, because it's my life. Who knows better about my life than me? Who knows better about what's going on in this head of mine than me? Like, the um your experience is entirely subjective. So you have to self-report, and um that's the thing. Like, I've gone to doctors before and they'll be like, "Oh yeah, take this self-test. Okay, there you go. Do you have anxiety? Do you have depression? Here, take these pills." And it's like, okay, so that's all it, that's the only criteria. Like, there's no other way for you, any symptoms or signs. Like, I studied psychology, and I think that the thing about university is not necessarily the best get through, the best and brightest get through. It's it's like school, and sometimes if you don't find the right school, the right it's or the right teacher or the right classes, you might not get what you need to get to the next level. And I feel like there's a lot of people who don't have bedside manner, or really that empathy that's required to be a psychologist, to put yourself in that person's shoes. Like, have you experienced depression? Do you know what it's like? Okay, so this person is coming and you see them, and that's the thing. Oh, I'm your psychiatrist. I'm only going to see you once a month because I have however many patients, when really you need to be seeing somebody once a week. But, oh, I've seen you for like the fifth time, and are you depressed? Oh, you said this one thing. Like, you hear voices. Okay, immediately, schizophrenic. But is it your own voice you're hearing? Or is it Peter Griffin? Like, who is it? Why is it? When you hear the voices, what are they saying? Why are they saying it? What is it relating to? Like, there's like no probing questions after they hear that you hear voices. Or, and some people, voices mean different things to different people. Some people like talk to God. Like, when they pray, they hear God. And it's like, are you misinterpreting what I'm saying because you want to get a diagnosis and to explain away all the other things that you might be seeing that you're not talking about? Or, like, say somebody has addiction issues. Like, and some of it I'm speaking from my experience, other people's experiences, and like, say somebody struggles with addiction. Um, you might um, say to them that you've relapsed. How do they react? How do they respond? Do they care? Is it an issue? Um, that's something that I think that a lot of people get stuck in this cycle of addiction and substance abuse, simply because they're not finding the right people and the people who care. Because that's part of it. Do you care about the people that you're interacting with? You may not know them, but again, somebody has addiction. Addiction might be a symptom, not the cause. It, because they say it's a disease. So what are the symptoms of this disease? What are the what is causing this? Is it mental illness? Where is this mental illness coming from? Are they stressed? Are they overly stressed? Is it their environment? Is it their friends? Is it other influences? Do I don't find that a lot of psychologists have these conversations, or even psychiatrists have these conversations with their patients. I feel like they're so quick to give a diagnosis and keep moving people through the system. I know I had this one friend, her parents were panicking, thinking that she was an addict, so they took her to the addiction center. And they just wrote on a paper, oh, they just asked, like, okay, so how much do you smoke? Okay, you're not an addict. And it's like, uh, if that's all it takes, if that's the only criteria, then uh, what's the difference from them seeing you right now to them coming back and seeing you a year or 2 years from now, and their abuse has gone up? Or the reverse, somebody might be they call it college binge drinking syndrome. So somebody might be abusing alcohol because they're stressed out in college and it's like a party culture and they have all these influences around them. And it's like, oh, you're an alcoholic. Well, it's like, not necessarily. I was just an alcoholic in college. So how do you know that their usage is not going to stop? How does it, because their environments change, so their influences change. And that's why for me, I really question, does um well, maybe the question shouldn't be does mental illness e- exist, or how we respond to it. Maybe I think some of it is great because we have all these new labels and ways to express what these issues are. But um that I just don't think we should just keep throwing pills at the problems. I think we should expand on it. Now, I felt like psychology, you were supposed to avoid the pills and do the work and put in the work. But it's like the textbook is more important than the work. And maybe it's because you have to keep a certain amount of distance from the patients or clients. There was this one psychologist here on YouTube, and he was called Daniel Mackler, and he kind of talked about the things he found about psychology. Uh, he um, he was saying things like he tells his patients what to say and what not to say because he knows what they mean. But if you say the wrong thing, you're going to get the wrong label. And doing it for your own good. And he talks about how some people have lived through things that are so traumatic that, like, in sessions, he's broke down crying because it was a lot. And he found that the patient was trying to console him instead of the other way around. And he talks about how the human mind is so flexible and so malleable. It's like people can go through a lot. And so what does it mean to be mentally ill and what does it mean to be mentally fit? Like, everything breaks down. Cars break down, technology breaks down, um bodies break down. Why can't your mind break down, get sick for a little bit? What does it mean if you're overall healthy but you had a moment, a lapse? Now they say schizophrenia. Now, is that what does it mean if you have schizophrenic moments but uh uh not schizophrenia like full time? Like, oh, this is like the first time in, I don't know, 8 months that I've heard something. Is that schizophrenia or am I just stressed? Now, you're bipolar. Am I having a manic episode or do I have genuine reason to be happy? Like, do I have every right to be in a good mood and my good mood is elevated by even better circumstances? Are you depressed? They say depression is supposed to, if it lasts more than 6 months, you have depression. But what if you're perfectly justified in being depressed? Like, your parent dies. Okay, you're going through depression. It's one of the hardest losses you'll ever experience in your life. Are you supposed to be mentally ill? Like, in the sense that you're not justified in those feelings? Like, oh, get over your parents' death. You have 6 months. Come on now. Like, I don't know. I I just feel like there's a lot of issues still in psychology, and I feel like I wish there were forums for people to speak psychologists and patients alike. I wish it wasn't so rigid, but if you have more information on that, that would be greatly appreciated. I think I'm gonna wrap it up for tonight, but it was a pleasure. Feel free to like, comment, and subscribe. I don't know. Let me know if you prefer an intro and an outro, like the typical YouTube format or formula. Um, I can try. Am I going to do editing? No, I promise you that this would be pure, unedited rambling, rambling and ranting. Uh, yeah, plus I don't know how to edit. I, and if you say, oh, you should take the time to learn, no.